Well, I mean, maybe the first thing to do is bring them to a patient flow summit and have them experience perhaps the nuances and the complexity of patient flow. Everybody sees these things from the vision of their own particular hospital and their own market, et cetera. So if you could expose them fairly early to a summit and they could see the range of applications of patient flow technology and patient flow critical thought, I think that would give them a very good idea of where then to go, for next steps.
The other opportunity with the Patient Flow Summit, it provides lessons learned. So why reinvent the wheel? And we're all looking for best practice. The Flow Summit actually is the best tipping point place to start to be able to do these components and figure out where you want to go, how did you get there, and what were your obstacles in the way, and how did you get around them. So if you know those going in, you're going to know what some of your challenges are, and you'll be able to avoid a lot of those things.
Well, the summit has evolved tremendously over the last few years. It has differentiated itself, I think, among all conferences in the United States by really focusing on this, being a very, very open and an open forum, if you will, for lively discussion. It has brought in people who are now really leaders in patient flow at an academic level, at a practical application level, and providers, practitioners, et cetera. So people who come here get exposed to this whole issue of patient flow on multiple levels and from kind of a multiple of perspectives. And so I just think it's really been valuable to give people insight and practical learning.
And to add to that, I think what we're all looking for is operational efficiencies. How do we best use our resources in the patient safety arena? How do we do well with handoffs in those components? And it's very, very important. And we all have the same agenda. We have people that are just starting out that have never been in the transfer field. And we also have people that have been doing it for a while. So I think it gives us an opportunity to brainstorm together and learn from each other.